Good afternoon, viewers. Hello. This is Jace Wakamau Official. I welcome you in the name of Jesus Christ. How have you been? Last time we were with you, I promised to bring a visitor to talk about mental health. Today we have her here. She will tell us in details about the mental health and the facility where we can take our patients, our clients. Welcome to our channel.
Thank you, Joyce. I'm glad to be here.
Karibu sana.
Thank you for giving me the opportunity to talk to our viewers and our clients and our friends.
Yes.
Because it is important for us to be mentally healthy. We know we are in a very difficult season of COVID, and mental health has been a big deal. So it is important for us to know where we are at. Are we healthy mentally? Are we healthy physically? Are we healthy spiritually? And all those other dimensions. But specifically today we are going to talk about mental health. So mental health is the ability for every one of us to be healthy. And maybe let me first give an explanation of what health is. And so health is a complete spiritual, mental, spiritual, and physical wellness without the absence of disease. So the fact that you have as a disease, it does not mean that you're not healthy. But specifically today, we want to talk about mental health.
Good. Thank you so much. And before you continue and you go to the details, I would like you to tell us who you are, what you do, so that we can know you.
Thank you. So my name is Fresia Kionjore. Fresia Kionjore is a clinician. I'm a counseling psychologist. I am a professional mediator. I am a trainer. I am a youth mentor. So I wear many hats, and I'm glad that this evening I'm here to talk about mental health, and that really has to do with my psychological counseling. Thank you.
Karibu sana.
Asante.
Thank you so much. We are glad to have you here. I'm so excited that today we are encountering so many mental problems, and I'm glad that for each and every problem that we have a solution.
True.
And we are trying to make our society come sober, and they come back to the senses in the by helping them to realize where they went wrong and to coming back, so that we can be productive in our economy.
Yeah.
So continue telling us what you are doing and what you are doing to help this and where we can get to. Now take the floor.
Thank you, Joyce. I really appreciate. Thank you very much for allowing me again to be in this platform. So I began by introducing myself. I said I'm Fresia, and I run a medical facility, one in Kasarani, that is specifically for physical illnesses like malaria, typhoid, and all. And then I also run a rehabilitation center in Rimuru called St. Joel Community Hospital and Recovery Center. So that is where we are mainly dealing with the mental health issues and the psychiatric issues that we have in our society. So like I had said in the past, we want to talk about mental health so that we understand, are we mentally well? So that as we go on with our day-to-day activities, we are sure that we are healthy. So the first thing that we want to look at ourselves is, how do we reason? How do we think? What are the behaviors that we show? Because that is how we know that we are mentally healthy. And so I want to relate how the brain and behavior, how the brain is related to behavior. Because many people, when they are mentally ill, they will not know until others see their behavior. And so they can tell that this person is either mentally healthy or mentally unhealthy. So what are some of those behaviors that we are going to have that people will say this person does not look okay? So one of them is some people will be very aggressive. Others will find them extremely sad. Others will find them extremely talkative or excited. Others will find them, crying a lot. Others will find them taking a lot of substances. For example, alcohol. Alcohol is the most common. Others will take other drugs like bang and other drugs that are not right, like cocaine and heroin. Others will be found fighting, We have had a lot of issues with domestic violence. And some of the things that you will see, you can actually tell that person is not mentally healthy. So I want to classify some of those mental illnesses so that when you see somebody with that kind of a behavior, then you are likely to tell that this person is not mentally stable, and you also need to help them so that they are able to seek help. Remember, somebody who is having a mental illness, they might never know they have a mental illness. So it is important for us to understand and know so that we can help our loved ones, and we can help our friends, and we can help our colleagues and the people that live around us. That is our neighbors. So the most common mental illness with this season of COVID is depression. So how does a person present when they have depression? So people who have depression, you will find they are unnecessarily sad, they want to stay by themselves. You find them tearing easily. Some of them, they'll have a very low appetite. Others will have a very high appetite. Others will use some drugs like alcohol. You find them drinking too much. And when they drink too much, they are likely to talk some things which are not, the society does not really allow it. Some of the ones that people will say, you will realize that is not what the society really appreciates. Yeah, other instances of depression is when you find somebody, missing work, absconding from work. If it is a child, they refuse to go to school. They'll have reasons as to why they are not going to school, especially our teenagers. Then we'll also find instances where people will keep on faking, things. They'll keep lying. And you realize that this person has changed. So that is depression, which is very, very common in our society, especially during this season. The other very common behavior that we have seen in people is addictions. So addiction is when you find somebody using something, or probably, using a drug like alcohol, which is the most common, and other drugs like bang. And they will drink and drink and drink, and that is what we normally say, drinking themselves silly, so that they'll miss going to work, or they'll miss to do their normal responsibilities, or they'll drink until they're not able to take care of their basic needs. So that, again, it is a show that person is mentally unhealthy. So we also have some other personality disorders, like narcissism. Narcissism, we find those patients are very aggressive, they are very abusive. Sometimes they think about themselves and they don't think about others. They're likely to do things that, later somebody would wonder, why would you do such a thing, Other disorders are like bipolar. Bipolar, somebody at one time they are very excited and they are very happy. In medicine, we say they are manic. And other times you find them very sad, and they want to withdraw from other people, and they want to be by themselves. And so at that particular point, we say they are depressed. So bipolar personality disorder is where you find a patient has almost a double personality. Today they are very excited, and tomorrow they are very sad. Or in 1 minute they are very happy, and another minute they are very sad. We also have other mental conditions like schizophrenia. Some of those people, they will say things, they will do things like hallucinations. They will say they are seeing things that are not, that others can't see. They will say they are hearing some voices and some noises. They will also say they can, see things that others are not seeing. And so those are some of the signs and symptoms that we can see in our friends and in our relatives, so that we can tell that these people are mentally unhealthy. So I know we have seen many of such in our society. Sometimes we don't know what to do. If we are really spiritual, some of us will think these people have grown mad, and we take them to pastors for prayers. Others will go to witch doctors. Others will go back to the family and say, because this that has not been done in the family, we need to do this and that. But I am here to tell us that it is important for us to have these people examined by a psychiatrist, and eventually a diagnosis is made, and then we make a line of treatment. So how do we help such people? Maybe one of the very common one that we are having in the recent past, especially during this season of COVID, is addiction. You know, we have seen people using a lot of drugs like alcohol, like I've mentioned in the past. You see a lot of people using bang. You see a lot of people using nira. They call it muguka. The young people will use things they call shisha, you know, and they'll begin to display some of those symptoms that I've mentioned in the past. So what do we do with these people? So the first thing, it is important for us as a society to realize that this is a disease that should be taken as serious as any other disease, as serious as COVID, as serious as diabetes of cancer. So it is important for us to accept these people and seek to help them, because if we don't help them, we are likely to lose such a big portion of our population. So should you realize that your son, your daughter, your brother, your cousin, your sister, your friend, your colleague is going through this, it is important for you to seek help. So where do you seek help? The first thing you need to do is that you need to take them to a medical center where you're going to meet a doctor, and they'll take the initial history, and then they will tell you whether you can take them either to a rehabilitation center or they need serial review by a psychiatrist. And I'm happy to tell us that we are offering this kind of services in our facility in Shekinah Medical Center. We are located outside, right opposite Equity Bank. And we can examine your loved ones, and then we shall also tell you how we are going to manage them. We are also excited to tell you that we are now running a rehabilitation center. It is in Rimuru. It's called St. Joel Community Hospital and Recovery Center. So should you have a loved one who needs help, we are going to examine them. We are going to have a psychiatric review in the same facility. And if they need admission, we are going to admit them for 3 months. So that as we admit them, we are going to give them the necessary treatment. And then we are going to do them, counseling, because counseling is very important. We're also going to do family therapy, and we're also going to do group therapies. And after that, we are going to have an aftercare program for your loved ones, so that your loved one does not go back to the society and probably get back into the behaviors that they were displaying in the past. So I'm very happy to be here. Thank you very much, Joyce, for giving me this opportunity. And I pray that people will get helped. And maybe before I finish, it is important for you to for me to give you my contact so that you can reach out to us. So like I've said, we're in Shekinah Medical Center, situated right opposite Equity Bank. If you go to our Facebook page, you'll find us. My number is 0720 75 26 45. 0720 75 26 45. You can also visit our rehabilitation center. We are located in Rimuru sub-county, specifically in a shopping center called Gesha, and we are called St. Joel Community Hospital and Recovery Center. Again, you can get me on 0720 75 26 45. For the young people that are there and they're wondering what they are going to do, we are also doing a program for the young adults, so that we have a program for mentorship. We train you, and we ensure that you're not just sitting idle in your house. So you're very much welcome. Please come. Do not sit down with your problems. We are here and ready to help you. Thank you.
Thank you.